Gotcha.
I love that.
Hello.
Welcome. What brings you here all the way from Sacramento?
Mainly chest pain, and it's kind of like my mid-back all the way up to my neck.
Okay.
It's a lot of pressure, sometimes cramping.
Okay.
Sometimes I feel it here.
Okay.
So that's the main thing.
Number one is chest pain or chest pressure?
Pressure.
Pressure started when?
In March, but it's been on and off.
What happened in March?
I was sleeping and I kind of like felt my heart slow down.
Okay.
And I got up and immediately I felt like nervous. My ears started ringing and then it went away, but for the next 3 days the pressure continued.
Okay.
And then I think on the third or fourth day it came with a little bit more pressure. So
Were
I
you
went to the
getting
ER.
palpitations?
Yes.
So let me just, before we get to the ER, your pressure started to go low,
I guess so.
okay? Or were you feeling heavy?
No, not yet.
No heaviness?
No.
Okay, please continue.
And so I would occasionally, I would get palpitations and they would be accompanied with the pressure, but it would be quick. Like it would come and go, and I obviously was concerned because it's never happened before, but I think on the third day, the pressure was a little bit more intense, so I went straight to the ER.
Okay.
They did.
This is in Sacramento?
Yes.
Okay.
They did an X-ray, EKG. They told me everything was fine. My labs were fine.
What do you mean everything is fine?
Everything was normal.
So within normal limits?
Yes.
Everything is not normal,
Yes.
but everything is normal within those parameters?
Correct.
Yes?
Yeah.
Okay. I just want to be clear.
Yeah.
Okay.
And
Because
so,
if it was, you wouldn't be here.
Right.
Okay. Right.
So I followed up with the doctor. They told me that it was anxiety, or they gave me blood pressure medications, but I knew that wasn't it because I was
Did you have high blood pressure?
No.
Okay.
And then following that, I would lay down and the back of my arms would go numb.
Both?
Both of them.
More right or left side or equal?
Equal.
Okay.
They were numb and they were tingling, and then the same thing would kind of happen. So I looked into seeing a chiro, and I saw my MD, I saw an ND. They found that I had a vitamin D deficiency, subclinical Hashimoto's hypothyroid.
Hypo, yeah.
Yeah.
Okay.
And
Any nodules? Did they find any? No nodules, right?
for a while I was feeling okay, and then it's starting to come back again.
What is?
The pressure. And it's specifically I thought it could be costochondritis, or I might have a rib out of place.
You've been doing homework. What's your background, educational background?
Communications. But
What specifically?
Broadcasting and electronic communications. And then I have
Who sent you here?
No, myself. My spine, that needs
You got a hidden
alignment.
camera there somewhere? Just graduated?
Yeah,
Great.
I would have seen you sooner, but
Very cool. You graduated from?
San Francisco.
Nice. Okay. In broadcasting communications?
Yes.
What are you trying to do with it?
I wanna-
Spread the word?
Yeah.
All right. We have someone to spread the word now.
You know what's up.
I do know what's up. Do you?
Yeah, that's
All
why
right.
I'm
That's
here.
why you're here. Good. All right. Please continue.
Oh, I was seen in the ER again because
MD, ND,
Cairo, DC.
DC. What did anyone find anything?
It's the,
So the MD is looking at the bloods, at the images, no pathology, correct?
no.
No fractures, no tumors, no values in the blood skewed way off.
Well,
That-
except my TSH was pretty high, which the ND caught on to, so she ran me. She did labs for my thyroid. And
Okay.
That's how we found out that I have Hashimoto's.
So the ND found that,
Yes.
the naturopathic doctor,
Correct.
because whatever blood work you sent, your TSH was fine. Or have you been working on it?
Yes.
Ah, okay.
Yeah.
So whatever that person's been doing, they're doing a great job. She has balanced out the TSH. I was happy to see that. Thyroid looked good.
Yeah.
Okay.
June 9th, again, I was seen in the ER because I started feeling the pressure again. I went to urgent care. They told me that having subclinical hypothyroid problems wouldn't cause the pressure or like the cramping. And so they said if it got worse, go to the ER,
Okay.
which I did. And they ran labs on me again. They did an x-ray, an EKG.
Okay.
And they told me that everything was normal. Maybe to just
Again, within normal limits.
Within normal
Okay.
limits. Sorry.
All right.
They told
Okay.
me to take Tylenol to do some back stretches, and they injected me with, I think it was Toradol,
For what?
for the pain. And then
What's that? An opioid?
I
Cortisone shot?
I
don't know what it is.
I don't
Okay.
know. And so
Did it help?
it did. It helped with the pain, but
A
the
day?
pressure.
A week?
Almost instantly.
How long did it last?
That night.
Okay.
Yeah.
So it lasted the day.
Yeah.
Okay.
It
So
was-
the pain and pressure were back the next day.
Yes, but the pressure remained even after the injection.
Okay.
I realized that it happens when I'm laying down, when I'm trying to go to bed, and when I'm waking up. And so I figured it's probably a nerve or it's something in my back because,
You figured.
yes,
Okay. Good.
I've been low-key diagnosing myself, trying to be proactive about,
Okay.
you know, what's going on with me so that I can get better.
Balanced.
Yes,
Okay.
great word.
Yes. Because that's what this is about.
Yeah.
It's about getting you back in balance.
Mhm.
And the question is, when did you get off balance? That's what we need to really figure out. Okay. I have some ideas, by the way.
Okay.
And it wasn't 5 years ago.
Okay.
This is a while ago.
All right.
And we need to talk about it.
Let's do it.
Okay, so before we get there,
Mhm.
so number one is the chest pressure with some pain, or not the pain, just the
The
pressure.
pain is not there anymore, but it's the pressure.
The pressure, that's number one. Number two is the upper back,
Yes.
mid back, right?
It's mid-back going into my upper back.
Okay, and is there a number three?
Yeah, sometimes the mid-back kind of goes all the way up to here.
Okay.
And then the back of my head feels super, super, super warm or hot.
Warm and hot.
Yeah. And I take my temperature, but it's,
Temperature is fine?
yeah.
Okay. Do you get, so there's
Shoulder pain, yes.
shoulder pains?
Yeah.
Left side only, both sides?
Mostly my left side. Occasionally I will get it here. And I
Okay.
am off balance, I notice. I feel a little dizzy if my head is a certain way.
Okay.
I can't lay down comfortably. Like my head won't lay straight. I'll have to like turn it and I'll feel the strain.
I agree 100%. There are a lot of mechanical issues we need to figure out.
Okay.
Okay? What else?
That's,
That's a good start.
yeah.
Well, we need to also talk about this digestion. What's going on with your digestion?
Yeah, I knew
It's
you were
off.
going to do that. It is
And
off.
it is off in the sense she's testing me is what she's doing, guys. That's what's going on here. Because I see potential hypochlorhydria, low stomach acid.
Yep.
So the question is, but you have your naturopath working on this with you?
I do. I am taking supplements.
Do you have any HCl in that regimen? Hydrochloric acid? Any betaine hydrochloride?
I don't know.
Let me just check real quick, please. So I like that your thyroid was balanced, but I don't like what I'm hearing about the digestion. It's an easy fix, and it's an easy thing to get started. So it's not you have to take 3 or 4 or 5 things or one thing that has 5 or 6 things in it, okay? And it's kind of important because you can be taking 3, 4, 5 supplements, but if you're missing the one thing you need, then you need all that other stuff.
Yeah.
Does that make sense?
Yes.
So first question, before even working with the naturopath, the stool color, a little weird question, I know. Is dark or light, sink or swim? Or does it change color and buoyancy based on what you eat?
Well, I don't have a
Light, right now, is it light or dark?
it's dark, but it's not consistent.
Right, it's based on what you eat.
Yes.
And it sinks and swims, it alternates?
It mostly sinks.
Okay, so that's a good thing.
Yeah.
Okay. But there are days that it's rising,
Sometimes, yes.
and that's when you're off your diet or off your regimen.
Yes, and they're usually hard to pass.
Always?
It's typical.
Okay.
It's typical. I am taking magnesium and probiotics that I think the first 2 weeks I was taking it, they helped regulate it, but then after
It's not
that,
the
I'm like,
fix.
yeah.
I'm telling you, it's not. How long were you taking this stuff for?
Started in May, June.
So recent?
Yeah.
Okay. So it's going to take some time.
I
So,
love when you say, like, okay, this part of your back it neurologically controls blah, blah, blah.
well, we can say that, but it doesn't mean that's it, right? It's
Right.
just these are findings that we see,
Okay.
And there are very specific things we need to discuss in your film that's causing these structural issues that it's going to explain a lot of your stuff.
Okay.
The internal stuff, you did send me your blood work. I'll need to take a look at that for the next visit, okay?
Okay.
And because the focus is first your structure.
Right.
Right?
Right.
That's a good start?
Yeah.
Okay, so here's what we'll do. Watch you walk,
Okay.
go over your x-rays,
Okay.
figure out where we're going to start,
Sounds good.
and watch Mama yell and scream. Let's watch the dimples. Let's watch you walk several times back and forth in a sec. Let's take a look and see her overall posture. We can see this side is a little bit higher, this side's a little bit lower. If we're looking at the shoulder blades, this one's a little bit higher, this one's a little bit lower. This is a little more pronounced here. You're right-handed or left-handed?
Right.
Okay, left is a little bit lower. Follow it down, glute folds, higher, lower, flatter, more pronounced. Then from here, so potential ASIN ilium or PIEX ilium on this side. Here we do have rotation this way of the femur, external rotation of the femur this way, causing causing lateral pain. Okay, so external rotation here. What's happening here? This goes with it, and now it's causing a pronation issue on that right foot. And very similar is happening on the left side. Same thing. Rotation, rotation. They're going to be tender on both sides, yes?
Yeah.
Okay, sorry about that. Now let's watch her feet and let's watch you walk several times back and forth, please. Okay, just keep walking. So we have some, how are your big toes?
They're okay.
You get any pain with them?
Sometimes.
Okay, because you're
Even
doing,
if I walk for a long time, I get pain in my shins.
okay. Both shins?
Yes.
Okay. Now, we have some flat feet with some pronation issues. We have the big toe starting to get that deviation on both sides. Watch the dimples now. She kind of just goes side to side. That's a Sacktown jiggle, Mama. It's just doing this. She's swinging back. You see what, you already know all this, right?
Yeah.
You already know all this. It's swinging. It's just going back and forth. She's not moving through those hips. And all of this, that's where everything is starting in her foundation. You can see it's like,
Yeah.
this is your walk. Now,
Damn.
I'm sure the shoe patterns are pretty bad too. How often are you changing your shoes?
A lot, often.
You wear sandals more, closed shoe. Keep walking, please.
Sneakers.
Sneakers. You see that? It goes boom, boom, boom. Goes like this. Goes side, side, side. And she's just doing this side to side. What do you do for activity?
I used to work out like 5 times a week.
And now?
The gyms are closed.
Okay. Come over here and let's go over your films. This is a picture in time. These are your full spine x-rays. This is telling us kind of how you've evolved from birth, right? Now, you've heard me talk a lot about this. I'm going to be going over the very specifics of your case. 24 bones in the spine, 7 in the neck, 12 in the mid-back, 5 in the low back, and then we have the foundation of the building, which is the sacrum and the pelvis. Yeah?
Yeah.
Now we need to go through this and start with the foundation on this one. On this x-ray, we're looking at you from the side. We are designed to have 60-degree reciprocating curves, lady. You have 0 curve in your back. That's the problem. Okay, we're going to get to that though. Let's talk about your foundation and what are things that we're seeing. So I was marking your x-ray and something kind of popped out. I've been doing this 18, 20 years. And in the Gonstead work, you know, you see a lot of chiros out there adjusting both sides of the pelvis. That's not something we do in the Gonstead work. And in the Gonstead work and in the analysis, it's very rare that both ilias get subluxated, okay? And when it does, that's the true double subluxated ilium. And the way we analyze it, so I analyzed your pelvis, okay? And the vertical distance are equal. There's no rotation here. There's no sacrum rotation. So why does it look like all this? And if we go closer, we look at the obturator. So we don't have misalignment in terms of the measured difference. There's no measured difference here, or rotation. But we see the obturator shape is slightly different, right? This looks smaller, this looks bigger. Now when we measure it, this is smaller, this is bigger. This is the IN side, this is the EX side, which means what? When the ilium typically misalign internally, right? They go internal, it's going to cause that obturator to be smaller or thinner. When it subluxates or misaligns externally, this out, then the obturator shape will be bigger. Let me show you on this. Referencing the PSIS to the sacrum. And then we're looking at the obturator shapes here. So when this goes out, this hole appears bigger. That's what that is. So there is a potential that you have the INEX subluxation. And it's only the third time I've seen this in my practice. Not that I can't fix it, but 3 is a charm, right? All right. Okay, so that's number 1.
Yeah.
Now, let's do what's called the level foundation principle. This work is based on the level foundation principle. In order to have a stable building, we need a level base and foundation. Base is good. Foundation, there's not severe misalignments, but there's this. And that's probably what was overlooked. However, hear me out now. Let's say you did have that.
Okay.
And you told me you got adjusted. 5 times, 10 times?
5, maybe 5.
Okay, 5 times.
Yeah.
Did they put you on one side, boom,
Yes.
and then the other side, boom,
Yes.
but it felt the same?
Yes.
Like the hand position?
Yeah. And then following that, I would be laid flat on the table, and they would just kind of stretch my left hip, because my left hip was higher than the other one.
Okay.
But that's...
Okay, but you were going both sides, right? Well, there's something actually cool in your scenario. We're gonna attempt to do it in one move.
Okay.
It's Hollywood.
You gotta put your glasses on when you say that.
Well, I'll need my glasses in a minute. Okay, so number 1 is a potential INEX subluxation. Number 2 is you had a lot of tailbone injuries growing up, yo. You have bent coccyx. You have S1 and possibly S3 or S4. This coccyx is bent. We need to deal with that. S1 we need to deal with. S3 we need to deal with. That's number 1, foundation. Number 2, let's start now the level. First one to go off level, we're starting at the base. First one to go off is 5. 4 goes with it, 3 goes with it, 2 goes with it, 1 comes back to level. Next one to go off is 2. All of those go with it to T9. Next one to go off level is 8. 8 takes that whole thing back up to here. Your digestion and all that stuff is in this part of the spine where it starts. Starting down as low as T8. T8 is from T12. T12 is from L5. L5 is from sacrum. You follow the process?
Yes.
Now I want you to see this. This is actually very important because you have a bent sacrum. And the good news, here's the good news. The sacrum doesn't fully ossify until about 32 or 34. So there's remodeling to be done.
Okay.
I don't know, I'm going to do it in 2-3 visits, but we're
I'll
going
be
to
back.
get it started at the very least. Okay? So we have the bent sacrum. Watch, it bends like this. Do you see that?
Yes.
Mom, do you see that? Do you see the bend? And that bend, and then L5 goes out, so everything is going that way to the left. Body is compensating back right. You see that, right? Okay. Now, you got, what's that? You had gallbladder? Any gallbladder issues?
No, not that I know of.
Kidney stones?
No.
Pain in the side?
That's my left, yeah.
No, sorry, right side. Here. Anything in here?
Well, when you do that, yes.
You feel it? Okay. Well, you have now you mentioned there was some thyroid found and you were getting it worked on.
Yeah.
Okay. Were you getting it worked on through the working on thyroid or pituitary though?
You want to see thyroid?
Okay. So I see something a little different.
Okay.
And I see what we call there's calcification of the costochondral junctions in between the ribs, and we have what's called flailing of the ribs.
Yeah.
Okay, you've heard me talk about this too. There's a lot of excess calcium. Calcium and phosphorus regulation in the body is controlled by thyroid and parathyroid. So the fact that the thyroid is being worked on and balanced, then this should start to come around. Now you just started on it. It takes 3 to 9 months, okay, for that thyroid to balance out. Then it's doing its job. So I don't expect this to disappear right away. It may take a year or so, up to a year or so, okay? It's important. We have a potential at 5L at T12, at T8, at T1, and then this is just compensating. We're going to get to that. Do you understand this, what I explained? Do you understand this, what I explained? You also have a lot of scar tissue here as well, ma'am. And that scar tissue, whether it was from any of those she had some old, pretty good falls. Now, as we go up, T11 rib is off on the left side, okay? But what I want you to understand in this part, all of this is compensating for here. Now, before I get there, let's switch to this x-ray. You have what's called the poker spine. You have a completely straight spine. And because of that, you got no curve. We need to get you curved. You need curve. Needs to curve. She's watching videos. I like that. Okay, first line of defense, spinal curve, 60, 60, 60. You don't have it. But the good news is at least your discs are great. They've maintained. Okay? We have something here. Now at L5, all of this is straight. So as an example, in your case, jogging is not indicated, okay?
Okay.
At all. Walking, hiking, swimming, all that stuff is fine. There's your calcium. That's all that calcium I'm talking to you about. I'm getting to your chest pressure soon, okay? Don't worry. We're dealing with structure. Because the idea here, Mom, I want you to understand as well. I'm not chasing people's pains and pressures. Well, nerve pressure, yes. I'm helping you figure out what's out of balance so we can get back in balance. Okay? Now, this is also very important. We need to do your posture assessment. We take the lowest lumbar, L5. It should go through C2 and C7. And what do we see here? You're way anterior, right?
Yeah.
So, here and here. And it can be off a millimeter. So the whole point I'm trying to make is that she carries her neck and shoulder in front. And if we take this angle even, okay, that angle, 15 to 20 degrees times 10, she carries 150 to 200 pounds of pressure right here, and she got those rounded shoulders. We need to open that up and get the pressure off, okay, and get that curve. All of this is going to be from getting the curve down here. Everything else is bonus and secondary, okay? Does that make sense?
Yes.
Does that make sense, yeah? Okay. We can see the jaw, the ramus of the mandible. It's thicker on the right side than it is on the left side. Your right side is compensating. The question is it deviating left or right?
It deviates left.
Left, okay. So you have, again, you have the double subluxated ileum potential, and typically when the one side misaligns, the other side compensates. Your same side is compensated and subluxated. Okay? Who sent you? Someone's testing me. Someone's testing me. That's all right. I'll deal with
I
it.
didn't even tell you that. I was waiting to see if you would.
What?
My TMJ.
I know. Don't test me, please. I'm tired. I'm not tired from people. I'm just, there's a lot of work, yo. You have a lot of calcium, dude. I mean, we'll look at the blood work and figure that out. But again, you already have your naturopath working on it. She's doing a good job. It's just going to take time. And I need to get the power on.
Okay.
Can we get started?
Yes.
Have a seat. Starting at the base, first thing we're getting 10 points, C5, C6. Make that 12 points. 15 points, C1, potential occiput. So part of what I think is going on with this pressure, your structure is completely off balance. And because of that, your organs aren't sitting as they should properly. And you have this fascia, you have peritoneum. Have you heard of that term, the peritoneum?
Yeah.
So you have peritoneal organs. You have retroperitoneal organs, organs that are behind the peritoneum and the ones in front. And you have all these ligaments and everything holding things in place. Well, you're completely straight.
Yeah.
Completely straight. And if we go back here, look, this is the big thing, is T1 through T4 is heart and lung. And you're curving into the side of your heart. And I've had cases like this, no joke. I've had actually three that come to mind where they thought they were having a heart attack or palpitations, and everything was normal. And what it was the pressure from the spine because of the structure pushing into the heart. And especially when they ate a lot, they were getting bloated and full, and that's when they felt more of that pressure. Okay? So C1, CO, left side potential, 12, 15 points. C5, C6, C7 even. We got to investigate that. Right around T8, T9. Okay, and as we're getting down low, it's low. 10 points. 8 points, S3, S4, down low. Okay? So we have S3, S4, T8, C7, T1, C1, CO. Feet together, open and close the knees, please. Open and close. Open wide, please, and close. Open, close. Right side only. So the left moves. Left side only, and the right moves. She has a true INEX subluxated ilium. Interesting.
Keep going.
Keep going. So it goes that way when she does the left, do the right, and it goes that way when she does. You see that? It's going both ways. Both are stuck. Scoot back for me, please. Number 5. Tender. Not a little bit, though. S1, S2, S3, S4. That's tender there. I'm being firm on it. Yeah. S3 is tender, but S3 moves. S4. One more. I'm going low. S5. You okay with that? Yeah. Is that sharper there or there? S4. Now I'll be on the outside on the coccyx, okay? More tender on the right side, more tender on the left side. Same. Okay.
Right.
There. Yep. This is a AR coccyx. AR coccyx, S4. Let's continue. Head down, please. Round your back. Round. Round. She can't even curve the back. So here's what's going to happen as we get curve in her. Her pants are going to feel weird. She's going to think that she's getting bigger.
No, I lost a lot of weight.
I'm talking about the glutes. She's going to think her glutes are getting bigger because the pants feel different.
I won't complain.
What?
She She would love that.
Oh, okay. 7. 1,
That
2,
one from me.
3, 4, 5, 6,
That's
7. That one. 8.
Ouch.
8. You feel 8 more or 7? Starts
I
at
think 8.
yeah. Round your back. Round.
Sorry.
It's okay. I know things are hurting, okay? I know they're hurting. Cool. Okay. INEX ilium. T8. Let's check the neck. T1 right there.
Yeah.
So we have T1. We got a lot of stuff on her today. Ooh, juicy.
That's tender.
CO, C1. Nod your head, please. Nod up, up, left, right. That's good. Look. There. Right, left side doesn't want to move.
That's tender.
You feel that right there?
Yep.
Yep. You want me to check your jaw now or later?
Whatever you think is best.
Okay, look up. I do need you to drop that. Slowly open, open, open. So it deviates from left to right, and then the right compensates. Okay, slowly open. Okay, we'll deal with the right jaw. Okay, we're going to start on the left occiput, okay? There you go. So we're going to start on left occiput, and the reason why, lift up for a second. The reason why is we have to make sure the messages are coming down from the skull and the brain to the rest of the body.
I didn't know how tight this was.
Firm, you mean?
No, this.
It's firm, right?
Well, yeah.
It needs to be firm
To
because
hold me in.
to hold everything in place so we're not rattling too much, okay? I need this. All right. PS. PS. LS. PS. LS. Chin down. Okay, do me a favor. This is bothering me. Let's
Sorry.
just take that out.
Okay.
It's okay. There we go. PS. LS. Hooking the mastoid, chin down, and we're going to set it through. It's a nodding, scooping motion, okay? Nice and easy there. There it is.
Oh.
Gotcha.
I
Wow.
love that.
Ah!
Oh,
Open. Jaw's already different. Stand up, please. Face down. Boca abajo, por favor. So, because I did the occiput there, the next thing we're going to do is going to be sacrum,
Okay.
parasympathetic. Slide up, please. Okay. L5, S1, S2. Mama, come hold her legs. Down, down. There you go. Right over here, please. Deep breathing. All the way out. Light, light. Oh, yeah. You got her, Mama? She been a good girl? She been a good girl this week?
she is.
You sure? Any other kids?
Yeah,
Older, younger?
younger.
Good. That's a tiny bit. You're holding me.
Oh.
Gotcha.
God.
That's it. That's it. Gotcha. That's it. I gotcha. I know. You didn't know what to expect.
Nope.
Let her go, please. So that's the start. From that, hold my hand. It's okay, don't worry about that. Come off and let's walk a straight line back and forth, please. And let's just see from that. Keep walking. Turn around. Let me tuck the back in. Go ahead and walk. The dimples are moving up and down now.
That feels different.
What's different?
I feel more fluid here.
More fluid. There's freedom in through
Yeah.
there. So now you can see the dimples are going up and down as they should. Good. We still have to do the hips. The left ilium is internal, is down. The right ilium is external out. So I'm going to be, this is the move I'm going to contact. I'm going to do the EX involved side down by pulling it in, and at the same time bringing that top one out all in one move. Okay?
Alright. I'm excited you're excited.
Tuck forward. Tuck. Mama said crack you out. Tuck forward tiny bit. I need you to hold the wrist here.
Okay.
And I need to be right on there like that.
Okay.
Got it?
Yep. Oh, okay.
Are you okay there?
Yeah.
Shoulder.
Yep.
Sure?
Mhm.
I have to push that shoulder up quite a bit. Are you okay?
Yeah. Oh.
I only got the bottom one.
For real?
Yeah, I got to do a tie. Did you feel the top?
I felt something.
This moved. This has a little bit more.
Okay.
Tiny bit. The cobra's back, Mama.
Oh, it's the cobra.
You see how tight she is? That's not it. Come up.
I knew it.
That's not it.
Okay.
She's going to make me work.
I'm sorry.
Come on over here. Mama, hold her legs.
Let me move this out.
So we got the EX. We got to do the IN, the left side. I'm doing a lot right now for her, okay? Slide up.
Shoulders down.
Shoulders down. Right side is the EX. Left side is the IN. You good?
Oh my God.
Gotcha. Home run. That's what we wanted. Stand up and let's walk it out and let's see some more. Okay, go ahead and walk it out, please. Check it out, Mama. Completely different. It's okay. Just, yeah. Look. She got her groove back.
Yes.
That's
Earlier is-
crazy.
Earlier it's just going this way.
It was the side wiggle.
Yeah. Now it's going up and
She
down.
got her groove back.
I know.
Keep going. Check out your feet. They're different.
I know. I feel it.
Come back over here, have a seat. Starting at the base, top is clear. Now hold on, you got a lot of hair, dude.
Sorry.
It's okay, I'm gonna hold it there, okay?
You want me to hold it for you?
No, because then you're activating nerves.
Oh.
Occiput is clear. That cleared up T1. T8 is clear. Sacrum is clear. Now, let's continue. Let's palpate and see. Come over here. Look, Mama, she's getting curve in her back now. Check it out. She's getting a curve back. Mira, number 5. S1. Pretty cool. S2.
Oh, that's a little.
Tender. I'm pushing a lot harder. S3.
Yeah.
How's your S4 now?
Mm-mm.
Better?
I can tolerate it. Yeah.
Okay. Not bad.
No.
Scoot forward, please. Feet together. Let's see what happens here now. Open and close the knees. They're both moving. Right side only. Left side only. Much better. Still a little bit, but much better. Scoot back for me, please. Shall I continue?
Yes.
Just tune up the rest now.
Shoulder. Is it?
Yep. Ears first.
Oh, yes.
shoulder. AI shoulder. There. Nice. On your back, please.
I still feel that in my ears.
Now the feet. So guess what? You're a functional pronator. You have an arch when you're non-weight bearing.
I know.
So there's a potential we're going to get some of this back, okay? Now I got to work out the ankles. I'm going to be a little aggressive on the scar tissue, okay? Five, four. As you're laying down, what's different for you?
There's space right here. It's not flat. My lower back.
You have a space in there.
Mm-hmm.
Is there less pressure on your low back?
Mm-hmm. And usually when I am laying down, I feel pressure in my upper back, and it kind of radiates to my chest here, and I don't have that right now.
Chest pain is not there right now? Five, four, three, two, one. Now here's what's interesting. As I'm doing this, there's a lot of laxity in this left foot.
What does that mean?
It's loose.
Okay.
So I'm going to use the speeder board. I'm not going to yank it and pull on it.
Okay.
Okay? This one I will.
Okay.
Okay, ready?
Yep.
This one will pull. AS talus. Gotcha.
Oh my god.
Raise this. AS talus, medial tilt, bend. Actually, I can do it. Ah. There. Booyah.
Oh, good.
All good. Stand up, please. Let's walk one more time, and then we'll continue on the hands and elbows. And just from that, what?
My foot doesn't feel tight. Like I feel like I feel like I'm walking properly.
Mhm.
That's it's
Less pain.
yeah, because sometimes I'll have a tension right here, but I feel like I'm bending out my ankle.
Up on your toes, please. No heels today. She wears a lot of heels.
You can tell.
Yeah. On your heels. Walk on your heels. No heels for a couple months. Your choice. Elbow. Posterior distal radius. Posterior lunate. There. Squeeze. Posterior humerus. Posterior lunate. Posterior lateral scaphoid. There. Squeeze. Thumb.
Oop.
Squeeze. There you go. Squeeze. Turn that way. Let's do the ears. One more. This way.
Yep. Oh,
And this way. There you go.
that felt really good. Thank you.
Questions?
No.
Do you understand everything I went over?
Yes.
Okay. Welcome to the office.
Thank you.
You're welcome.